Are you looking to cut costs these days? Have you considered ways to optimize your Medicare cost savings? Hi, my name is Cristina. I'm a registered nurse with a background in care management, and I'm here to help you with your Medicare questions. Today, let's go over 5 tips that can help save you money on your Medicare costs. Tip number 1, don't miss those Medicare deadlines. If you're not already enrolled in Medicare, you've got a great opportunity to avoid a common Medicare mistake. Make sure to enroll on time during your initial enrollment period. This is a 7-month window surrounding your 65th birthday. Believe it or not, there are potentially permanent late enrollment penalties if you miss this window. That means that you could continue to pay the penalty for as long as you have Medicare. Oh boy, let's look at what those could entail. Part A, late enrollment. This is an additional 10% added to your premium, charged for twice the number of years that you delayed enrollment. This is only if you do not qualify for premium-free Part A. Most people do not pay a Part A premium because they have worked for 10 years or are a spouse of someone who qualifies for premium-free Part A. So that one's not such a big deal. But you're going to want to pay attention to this one, Part B late enrollment. Part B late enrollment is an additional 10% added to your premium for every full year that you delayed enrollment. This one is permanent. Part D late enrollment is an additional 1% for each month of delayed enrollment. Also, a permanent penalty. If you enroll late, you could needlessly be spending upwards of $50 or more extra a month. So if you don't plan to enroll in Medicare when you turn 65, you can avoid these late penalty fees by qualifying for a special enrollment period. One of the most common qualifiers for a special enrollment period is if you continue to work past 65 while also having qualifying healthcare coverage. There are many other reasons that could qualify. So if you're curious if your specific situation qualifies, you can click on the link in the description below, and it's going to take you to a Medicare questionnaire to help guide you on qualifications for one of those special enrollment periods. Another deadline that you'll need to pay attention to is scheduling your health savings account contributions. Make sure your last contribution to your health savings account is 6 months prior to Part A coverage starting. This will help you avoid a tax penalty. Now let's move on to the next tip. Tip number 2, check out possible Medicare Part B premium savings. Would you like to save exactly $164.90 a month? I know I would. Here are 3 ways that you could potentially save on those standard Medicare Part B premiums. Let's check them out. The first is Medicare Advantage rebates. Many Medicare Advantage plans or Part C offer a rebate-type program that will reimburse your Part B premium. They're also called Medicare Buyback, Giveback plans, or Medicare Part B reduction. Programs can vary by individual insurance company, but most of them work the same way. You won't receive a rebate check directly, but your plan would credit your Social Security check with a premium amount if you pay via your Social Security benefit. Or if you usually pay for your Part B premium in another way, the amount owed to Medicare would be decreased monthly. There are no income limits required to qualify, so ask your Medicare Advantage plan if this is something that they offer. You could also contact an insurance broker like our partners at Apollo Insurance Group to find out how to achieve optimal Medicare savings. You can find their phone number and more information by clicking on the link in the description section below. The second is the employer reimbursement option. If you're still working, your employer can reimburse your Part B, Part D, or Medigap premiums via Section 105 plan. This option is only available for companies with fewer than 20 employees. There are a few rules associated with this option, so it's best to ask your employer if this program is available for you. The third way to save on Medicare Part B premiums is with the Medicare Savings Program. These are state-run programs that can provide reimbursements. Let's cover it in more detail in the next tip. Tip number 3. Find out if you qualify for the Medicare Savings Program or the Extra Help Program for prescription drugs. A great way to save money is through your state's Medicare Savings Program. These programs are available nationally, but they're run on the state level through Medicaid. So if you qualify, you'll receive assistance paying your Part A and Part B premiums. You could even receive help paying deductibles, coinsurance, and copayments. Typically, you'll qualify if you have income and resource limits below the threshold. But it is important to note that you could still qualify even if your income or resources are higher than those thresholds. So the best way to find out is to apply through your state or speak with a member of your state health insurance assistance program. It's a long name, but they offer great help. We will get into more detail about this resource in a bit. The 4 Medicare savings programs are Qualified Medicare Beneficiary Program, Specified Low-Income Medicare Beneficiary Program, Qualifying Individual Program, and Qualified Disabled and Working Individual Program. Additionally, you could qualify for extra assistance paying for prescription drugs through the Extra Help Program. This program is specifically designed for Medicare beneficiaries with Part D coverage. If you qualify for one of the Medicare savings programs, you're automatically going to qualify for the Extra Help Program. If you don't qualify for Medicare savings program, you could still apply for Extra Help separately through the Social Security office. Now let's head to the next tip. Tip number 4. Get free, unbiased, and expert help comparing Medicare plans. The best way to make sure that you're saving every penny is to enroll in a Medicare plan best suited for your needs and budget. But with so many options out there, it can be overwhelming to choose one, and it can be hard to know who to call or trust for questions. Luckily, every state offers free, unbiased, and expert help to its residents through the State Health Insurance Assistance Program, also known as SHIP. These SHIP programs are federally funded, so you don't have to worry about their staff trying to sell you a certain plan or policy. SHIP staff members are expertly trained to be able to help you review health and prescription insurance plans. They can also help you apply for assistance programs and answer those complicated Medicare questions. You can find your local SHIP representative online. I've included the link in the description below. Or if you prefer to compare plans online yourself, Medicare offers an online comparison tool. I'll also list this link in the description below. This tool will allow you to do a side-by-side comparison of Medicare Advantage plans, Medicare drug plans, and Medigap policies. It doesn't, however, include Original Medicare. When using the tool, you can even enter your doctors and prescriptions by name to find out if they are in network with the plan. This is a great way to view your options simultaneously and save time without having to go to each company's website. We've made it to our last tip, which is tip number 5. Utilize Medicare's preventive care benefits. As a Medicare beneficiary, you are entitled to receive preventive care services at no additional cost. It's wise to take advantage of these services to help you achieve your best health. Some of the preventive care that Medicare offers includes screenings, vaccines, exams, counseling, and education. Things like the annual wellness visit, cardiovascular screenings, Medicare Diabetes Prevention Program, and mammograms are some of the included services. By identifying your health problems early on, you can treat them sooner and save money in the long run. If you want to know more about the different Medicare parts, you can check out this other video. Follow us here on our YouTube channel by hitting that subscribe button below. Ask questions in the comments and we'll be sure to answer them. Thank you so much, and I'll see you next time.